Welcome again to our webinar series. Today's going to be on supporting Southern African displaced communities, practical mental health approaches. We are the Resource and Empowerment Technical Assistance Center for Behavioral Health, RMTAC for short, and we're made possible by funding through the Substance Abuse and Mental Health Services Administration, SAMHSA. So these are the areas that we're going to be addressing during the presentation today. We do encourage you to note any questions that you might have throughout the presentation because we are going to have a Q&A session at the end of the presentation. And I'm going to hand it over now to our lead clinical consultant, Dr. Mutsa Majero.
Welcome again. My name is Dr. Mutsa Majero, and I'm the lead clinical consultant on the RMTAC team. I'm really excited to present on this topic today as someone who fits the description of this target population and also a provider who has worked with this population. Okay, moving on. So what we hope that you will gain from this presentation are listed on this slide right here. We hope to kind of provide you with somewhat of a better understanding of the common mental health concerns and stresses affecting Southern African newcomers. So not just specifically South Africa, but Southern African. Okay, so we'll tap into that a little bit more. And we'll explore culturally responsive and trauma-informed approaches to screening, engaging, and supporting this population. Lastly, we'll discuss practical strategies to reduce barriers to care and strengthen mental health supports within clinical and also community-based settings. Okay, to start, I want to kind of ground us in why this topic matters, right? So across the US and globally, really, providers are increasingly working with more individuals and families from Southern African countries. And often they're doing so without a lot of context about the specific displacement experiences that shape mental health for this region. So Southern African displacement has some unique dimensions, right? So many individuals experience prolonged stays in refugee camps, sometimes for years or even decades. Others face severe restrictions on work opportunities, education, mobility, all of which deeply impacts identity and self-worth long before they even engaged in the resettlement process. There's also the reality of xenophobia, particularly within parts of Southern Africa itself, where displaced individuals may face violence, discrimination, and exclusion, not only from systems, but from surrounding communities that they flee to receive support. So that kind of repeated rejection really leaves a significant psychological imprint. And for me, this topic is also deeply personal because I am a Zimbabwean who's moved to America at a young age. And I've seen how displacement isn't just about crossing borders. It's about that loss of identity, shifts in family roles, and the grief of leaving behind a life that made sense, right? So when mental health care doesn't account for some of these layers, we really risk focusing on only symptoms rather than really understanding people's full stories. So the hope is that today we kind of bridge that gap between clinical knowledge and then lived experience, and also intention and impact as well. So what do we mean by Southern Africa? So when I say Southern Africa, I'm talking about a region, right? So not one single culture or experience. So this includes some of the countries that are listed on this slide. And it's important to note that there's enormous diversity across this region. So not only in language, but also ethnicity, religion, and social norms. At the same time, many countries share historical and structural factors such as, colonial legacies, labor migration, political instability, and regional displacement patterns all throughout that space. So when we talk about Southern African communities, we're holding two truths at once, right? So really looking at like the deep diversity within this region and also some of that shared contextual experience that they have that really shapes their mental health and help-seeking behaviors. So while this webinar centers around Southern African perspectives, many of the themes that we're going to discuss are not limited just to this region, right? So experiences like collective worldviews, stigma that surrounds mental health, use of spirituality or traditional explanations for distress, strong family ties, all of these are common across many displaced and immigrant communities. So if you also work with individuals from East Africa, Middle East, West Africa, Latin America, Southeast Asia, all of that, a lot of what we discussed today is still going to resonate. So the goal here is to remember it's not to generalize, but really just to kind of offer some frameworks and approaches that can be adapted thoughtfully, while we also make sure that we're staying grounded in each client's unique cultural and historical context. So when we think about mental health for displaced communities, it's helpful to think in terms of phases, right? Rather than just one single moment of trauma. So pre-migration stresses often start long before someone even leaves their country. So these include, like we noted earlier, political instability, economic collapse, persecution, uncertainty. But something that's really important to name here is that sense of cultural bereavement. And that's the grief that comes from anticipating the loss of familiar ways of life, right? So loss of language, social roles, community, and shared meaning with individuals. So even before migration happens, many people are already grieving who they're becoming and what they're leaving behind. Um, and then migration-related stressors can include dangerous journeys, detention, long asylum processes, family separation, extended periods of waiting with very little control. This phase often reinforces that sense of like feeling powerless and just uncertainty. That unpredictability of a lot of the systems really can cause a lot of stress. And then we move into post-migration stressors, which are often where I see the stress really kind of like intensifying with these populations. One major shift is family roles and gender roles. So many Southern African communities are quite patriarchal, and they usually have very defined, clear roles, often with men as the primary breadwinners and authority figures. Now, after resettling in the US, those dynamics can quickly change, right? So a lot of times the women tend to enter the workforce a little bit sooner, or might find more stable employment, like in fields like healthcare or service roles. And sometimes they start to earn more money than their partners. So even when families are supportive of one another, those shifts can create quite a bit of tension, loss of identity, feelings of inadequacy, and it's hard for them to really kind of talk about. I see this a lot within my own Zimbabwean community. Another significant stressor is loss of professional status or de-skilling. So this is where like people who are highly skilled in certain fields, like they may come and have previously were doctors or teachers, engineers, administrators, and then they feel like they have to start from scratch if their credentials and qualifications don't translate here. And that happens a lot. A lot of times if people are fleeing, they may not move with all of the documentation that they need, or really transfers maybe just don't align. And this can deeply impact that sense of self-worth and contribute to a lot of depression, shame, or withdrawal. We also see parenting and authority shifts. So in many countries in Southern Africa, discipline is understood differently, and parental authority is rarely questioned. So in the US, children have more formal protections and avenues to like speak out for themselves, which can feel confusing or frightening for parents who are trying to adapt while also fearing involvement with systems that they really don't understand. So this can create a lot of stress, fear, and conflict again within the household. And there's also that piece of the intersection of being both Black and a refugee or a newcomer in the US. So for many Southern African clients, resettlement doesn't just mean adjusting to a new country, right? It also means navigating racism, discrimination, system inequities, sometimes for the first time ever, really, in this specific type of like racial context. So they may be processing trauma from displacement while also experiencing all of this like profiling, workplace discrimination, housing barriers, microaggressions, and that type of layered experience of being Black and an immigrant can compound stress in ways that really deeply impacts their mental health. And it's important for us as providers to kind of recognize that what might look like anxiety, withdrawal, mistrust can really just be a very real and reasonable response to ongoing racialized stress. So kind of taking all of these together reminds us that safety does not automatically equal stability, right? So just because they move to the US, they're safe from whatever they may have been facing previously, it doesn't mean that life is stable. So even when mental health services are available, there are still many barriers that prevent Southern African clients from accessing or even staying engaged in care. Some of these barriers are structural, and then some of them are more practical, right? So transportation is a major one. Limited access to reliable transportation, long travel distances, and flexible work schedules, all of that can make attending regular appointments really difficult. There's also that piece of financial barriers that plays a big role, including lack of insurance, high copays, or even them just prioritizing basic needs. Like they need to make sure their housing is good, food is good. So they're going to probably prioritize all of that over their mental health. There are also fear-based barriers, right? So particularly related to immigration status. Even when services are legally available, the clients might worry about how is my information going to be shared? What kind of systems are, connected? Or just feeling involved with any institution can feel really risky for them. So for individuals who've experienced, surveillance or state violence in the past, that fear it's a learned fear. So it's not just this abstract concept. Cultural and family expectations can also really shape help-seeking behaviors, right? So in some families, there's, again, like we talked about, there might be some of those rigid roles and expectations, and these may surround the idea of like strength and endurance, and that can discourage individuals, particularly men, from seeking mental health support. So emotional distress might be seen as something that should be managed privately or within the family and not really talked about with anybody outside of the family. That's a big aspect in a lot of Southern African cultures, is that space of we just keep things in the family. Another important barrier is how mental health itself is conceptualized, right? So distress is not always going to be named as using clinical terms like anxiety or depression. And this really is tied to that stigma and mistrust of Western mental health models. So a lot of times you'll see individuals from these countries they'll display distress or expressive through somatic features. So like headaches, fatigue, chronic pain, as well as spiritually. You'll most likely hear a lot of talks about like spiritual beliefs, or I feel like they're having a spiritual attack, rather than really naming that this is anxiety or this is depression or even some sort of serious mental illness. So when providers are kind of relying just on that Western diagnostic language or Western lens, you really can risk missing a lot of what clients are actually communicating, and that leaves them feeling misunderstood, and then they're not going to want to engage in services at that point. So now with guiding principles, I want to just kind of focus on two closely related ideas, which is culturally responsive practice and cultural safety. So culturally responsive practice really kind of starts with that space of us as providers just engaging in some ongoing self-reflection, right? So this means regularly just taking a pause to examine your own power, your biases, your assumptions, including the assumptions that you may have about family roles, communication styles, education, or what like healthy coping looks like. It's not a one-time type of reflection that you should engage in. It's something that's important to be continuous. So you might talk to some clients and they'll share these are the ways that they cope. And you might have that sense of like, why is that even a coping strategy? It's important to kind of just pause and ask yourself, why you may be thinking that way, or are you even considering the client and their culture in all of this? It also means creating environments where clients feel respected and really taken seriously. So for Southern African clients, this might involve understanding the importance of formal greetings. Titles and credentials are very important in some of these countries. So even when I moved here, I had a really hard time calling anyone older than me by their first name. It always has to be Miss, if there's a credential, if you're a doctor, this or whatever. Those are very important. So it's important to just kind of remember that and address your client and ask your clients how they want to be addressed. A lot of times, if you're a younger clinician working with an older Southern African client, calling them by their first name may feel very disingenuous to them. So asking them if they want to be Mr. John or Miss Sarah, whatever it may be, making sure to engage in conversations in a respectful tone and allow some time before moving into personal topics as well. So rushing can sometimes really be seen as like just dismissive and unsafe. A key principle here also is making sure to center the client. They're the expert in their own culture and experience, right? We hear this all the time as providers. So what does that even look like? That's like that concept of just don't assume what distress means. Instead, take some time to ask them, like, how do you understand what you're going through? What do you believe is causing this? Because I've had Zimbabwean clients who might describe distress in relational or spiritual terms rather than using emotional labels. And rather than dismissing that or being quick to use all these clinical terms, it's important to just pause and just understand, take some time to understand that and make sure to honor it along with psychoeducation. So you can do both. You don't have to just be rigid in your approach. Culturally responsive care also involves adapting services to fit the client's context, right? So this can include making sure to offer flexible scheduling and involve family members when it's appropriate. I know a lot of times individuals from Southern African countries, a lot of decisions are made with family. There's not that just individualistic, I'm going to do what's best for me. It's that concept of I'm going to do what's best for the family. So if it's appropriate to involve family members, do so, whether through consultation, family sessions, all of that. And it's also important to make sure that you're using interpreters thoughtfully and don't use family members as interpreters, because that can also really kind of inhibit what information is shared or what feels safe. So make sure that you're doing so in a way that preserves dignity and confidentiality. Cultural safety also kind of builds on this by shifting the focus from the provider intention to the client's experience, right? So in culturally safe care, the client decides whether the care feels safe, whether it feels respectful, whether it feels relevant. So you're really in cultural safety, you're really kind of acknowledging power openly. And for clients who've experienced, xenophobia, violence, discrimination, and not acknowledging that power can be re-traumatizing. So it's important to be open with it. So ultimately, culturally safe practices are about actively reducing harm. So how are you working to prevent re-traumatization? How are you working to build trust over time? It's not about getting everything right. It's just about being open, accountable, transparent, and willing to learn from your client. So what does trauma-informed practice look like with displaced communities? Trauma-informed practice starts with that understanding that trauma doesn't just affect emotions, right? It affects brain, body, and behavior. So a lot of times for displaced individuals, trauma is often, it's layered, it's prolonged and it's layered. So chronic stress can keep the nervous system in that state of constant alert, which really can affect memory, concentration, sleep, emotional regulation, physical health. So what can look like a client is disengaging, or they're irritable, or they're inconsistent, could be their body's way of trying to stay safe. So a trauma-informed lens kind of allows you to view behaviors as survival responses rather than non-compliance or a lack of motivation. For someone who's lived through a lot of instability, unpredictability, if they've experienced harm from authority figures, that if they're avoiding services, if they really kind of feel like they have their guard up, that can be adaptive behaviors, right? Those are learned behaviors. So it's important to just kind of have that in mind as you work with clients. And this is why trauma-informed care prioritizes emotional and physical regulation before really diving into processing and trauma work. So making sure that you are helping your clients feel grounded, oriented, and safe in their bodies is usually the first step. And we'll talk about that a little bit later. Making sure that you're being transparent as well is key. Clearly explaining what will happen in sessions, why certain questions are being asked, what choices the client has, that can really help to reduce anxiety and help build trust. Offering choice and pacing of your sessions matters too, right? So making sure to give clients control over topics, timing, interventions, respecting when someone isn't ready to go deeper in sessions. In many displaced communities, including Southern African contexts, storytelling is very important, but trauma narratives should come after there's some sort of stabilization and some coping skills are in place. So it's important to, like, if you know that, oh, client from this region, storytelling is great, don't just dive into the storytelling. Make sure you've built a space that's like safe, where when they do start diving into that, when they walk out of your office, go home, they've got coping skills in their bag that they're able to pull from if kind of some of that starts to resurface some traumatic memories or experiences. Screening can also be a really helpful tool, right? But only when it's used in ways that are, again, trauma-informed and culturally responsive. So as we know, a lot of standard screening tools were developed in Western contexts and don't always capture how distress is expressed in Southern African communities. So as noted earlier, emotional pain might be expressed physically, spiritually, or relationally, rather than, using specific terms like anxiety, depression. That's why how we screen matters just as much as what we're screening for. So one tool that's helpful to mention here is in the DSM-5, there's that cultural for formulation interview, or CFI. It's a set of structured questions that are designed to kind of help you as a provider understand how your client defines their own problems, what they believe is causing them, and how their cultural background shapes their experience, and also what kind of support they feel like would be helpful for them. So what I appreciate with the CFI is that it really kind of shifts us away from that fitting someone into a diagnostic criteria, which, again, as we discussed, is important because a lot of these Western diagnoses and criteria are not, they don't have some of these like Southern African communities in mind, or just anyone who's not of Western descent, right? So it's important because it kind of shifts us from that diagnostic criteria and actually has us just pause and ask, like, how the client understands what they're going through. And that small but simple shift can really dramatically increase what feels like cultural responsiveness and reduce the risk of misdiagnosis. Another key practice is explaining the purpose of screening upfront, right? So make sure that your client understands why questions are being asked, how the information will be used, and who will have access to it. That transparency is key to reducing fear and just helping to build trust. It's also important to ask permission before you dive into sensitive questions, right? Rather than just assuming, oh, they're here in therapy, so they consent to us just diving deeper. Using plain, non-clinical language can also help make screening feel a little less intimidating and more conversational. Trauma-informed screening also means just normalizing reactions that clients may have to stress and trauma, letting them know that many people experience similar responses after displacement can help to just reduce that sense of shame or any self-blame that they may be experiencing. And we also want to make sure that we screen for strengths, right? So not just challenges. Make sure to ask people about coping, about support systems, about faith, community, past resilience. All of that kind of provides a more complete and dignified picture of the person that you have in front of you versus just looking at them through like a deficit lens. And and making sure to just remain flexible, allow clients to move at their own pace. If they want to skip some questions or come back to some more difficult topics later, that's okay. Allow them to feel like they have some sort of sense of control in their treatment process. In terms of engagement strategies, so when engagement works with displaced communities, it's really rarely like you're using a specific technique. It's that space of like just building trust first, right? So for many Southern African clients, trust develops through, again, that space of consistency, relationship building, and not rushing through things. So a provider, for example, might spend the first few sessions just simply learning about the client's family, their migration journey, their daily life, without pushing into that trauma space really quickly. That investment really is gonna pay off, right? Because you want to create that sense where you're normalizing mental health talk. If you just kind of dive in with all the clinical terms and we're going to talk about trauma, that's very scary for a lot of clients. And Something that's also really important is respecting hierarchy, respecting family roles and community norms. It's also really important for this population. For instance, in some families, an elder or a head of the household, they may play a really central role in decision making, right? So like I noted earlier, a lot of times clients from this region will involve their family in a lot of the decisions that they make. So it's important to kind of check with your client about if it would be helpful to involve a spouse or an elder, rather than assume that they're just engaging in this like individual decision making type of space. So that helps to kind of build your credibility, and it shows that you're respecting their culture and have an understanding of what's important to them. Of course, it's important to leverage community leaders or peer support that can really help to increase engagement. So partnering with trusted faith leaders, community advocates to help them kind of have these conversations around mental health services that can help reduce stigma, make services feel a little bit more familiar and acceptable. I know that there's, well, specifically in Zimbabwe, Christianity is one of the more popular religions, and people really lean into spirituality to cope. So I've previously been invited to speak in Zimbabwean churches to talk about mental health and just kind of normalize those conversations. And that's really important. It's helped people feel like, okay, if we're talking about it in church, we're talking about it in community settings, maybe I can kind of, it's okay for me to seek help. It's okay for me to seek support. So making sure that you're partnering with individuals that are meaningful in these communities is really going to help to allow your clients to feel just a little bit safer approaching specific topics or just showing up to services. Integrating mental health care with primary health care or any type of like holistic support is also another effective approach. A client may resist like therapy, right? But they may be more open to having a conversation with a provider about topics like stress, sleep, or headaches. So you can still talk about all of those and then how it relates to mental health, right? So if you're kind of partnering up with other individuals in primary healthcare or holistic supports, that can help. And clients are more likely to show up for medical appointments than they are for like mental health appointments. So if there's some sort of integration in that space, it feels a little bit safer or can feel safer. Being flexible in communication channels also makes a difference. Some clients may respond more consistently to like apps like WhatsApp. I know my family barely even checks regular text messages. If I'm like, I sent you a text, it's like, is it on WhatsApp? So maybe that's a better way for you to reach your client, be more flexible with how you communicate with them, and do what feels comfortable for them. And also just making sure to meet them in community spaces rather than in clinical office spaces. That can also help, like we noted, church spaces, all of that. And of course, again, providing choice and transparency is just essential in empowering your clients, making sure to explain options, outline what sessions will look like, and also making sure that they understand that engaging in services is voluntary. Well, depending on the setting that you're in, but if it is a voluntary space, then that can help to restore a sense of control, something that a lot of these displaced individuals, have kind of repeatedly lost. Okay, so when we talk about regulation, the goal is to help clients feel grounded and safe in their bodies before we start diving into deeper trauma work, right? So just kind of having simple, accessible strategies can really make a big difference. For example, grounding exercises, like the 5-4-3-2-1 technique, where you tell a client that, if they're in a state of anxiousness or panic, to just kind of pause and notice 5 things that they can see, 4 things that they can touch, 3 things that they can hear, 2 things that they can smell, and 1 thing that they can taste. That can really kind of bring somebody right back to the present moment, especially when anxiety and flashbacks arise. Breathing techniques like box breathing or square breathing, where it's like you take a deep breath in for 4 seconds and you're kind of envisioning making a square. So you take a deep breath in for 4 seconds, release for 4 seconds, in for 4 seconds, release for 4 seconds, while envisioning like creating a box. Again, that can help bring somebody right back to the present. So psychoeducation complements regulation, right? So it's about giving people language to understand what they're experiencing. explaining stress, trauma, and coping in ways that normalizes their reactions, teaching the basics of psychological first aid, like safety, stabilization, connection. Those can really be life-changing for someone who hasn't had access to mental health support before. And then culturally relevant approaches are obviously especially important, right? So in many Southern African communities, including Zimbabwean communities, lessons and meaning are often shared through, like I said, storytelling. So listening to stories, sharing personal experiences, using metaphors can also help people understand coping and resilience in a way that feels a little bit more familiar. Music, drumming, prayer also can serve as natural regulation tools and ways for them to process emotion, connect with their community, restore a sense of balance. So make sure to just incorporate all those things that are meaningful for clients. And a client might find grounding not only in like formal exercises that we talk about, right? They might find grounding in singing a hymn that's familiar to them, or listening to traditional songs, or telling stories about overcoming challenges. All of these are things that are already like things that they do in their everyday life and can be really powerful when you kind of highlight that and help them to incorporate them a little bit more intentionally. So there's a lot of things that we know that, a lot of times when you talk to clients about coping skills, it feels like, oh, I have to start doing this whole new thing. But it's so helpful when you show them that just some of the things that they do in their everyday life, it already serves as coping strategy. So if they just pause it, they're more intentional with, okay, I'm going to sit and listen to this song that reminds me of home or my community, and I know that will help regulate me, encourage them to do so. So, the regulation and psychoeducation, it's really about giving people both practical skills and also a framework to understand their experiences in a meaningful and empowering. So on this slide, I'm just going to show a couple of realistic ways that practical tools and engagement strategies can kind of come together, right? So warm handoffs. So this is when you introduce a client to another support service. So we talked about, being able to integrate services. So if it's a mental health provider, a community organizer, a peer mentor, making sure that you introduce them directly and intentionally rather than just giving them a referral can really go a long way. So for example, you might actually sit with a client and call the next provider together with the client, explain what the client has already shared, arrange the first meeting to be in some sort of like a familiar space. That can emphasize that continuity, trust, and relationship building. It also really helps to reduce fear, stigma, and it makes it more likely that the client will actually engage in those additional services you might want them to get into. Group psychoeducation is another great example. These are brief sessions where you can provide information about mental health, coping, cultural adaptation, while using culturally relevant language and methods. Again, in these spaces, you can use the storytelling, music, discussion, all of that. You might have them open up about their sense of resiliency as they face challenges, or invite clients to share specific experiences that they can use and you can use all of that or this space to kind of slowly bridge into that discussion about stress, coping strategies, and additional support systems, right? So it helps build a sense of peer support. It normalizes mental health discussions and can engage family and community, which, as we know, is key in a lot of these collectivist cultures. So if group psychoeducation is an option that you can offer, I would highly encourage it, as it allows for like really just like small digestible introduction to some mental health key terms that we want to make sure our clients understand and have avenues to cope. And as we wrap up, I just want to shift the focus to strengths and resilience, right? Because this is where we kind of really see the real potential in working with displaced communities. So what do refugee communities bring? Southern African refugees and newcomers, they often they carry remarkable resilience. So despite the challenges of displacement, many of them are really deeply motivated to rebuild community values, to maintain connections, to care for one another, to create safety and belonging. There's a term in Southern Africa called Ubuntu, And it's an African philosophy that's sometimes it's roughly translated as I am because we are. And that's a really strong example of that sense of community. It's the idea that healing and well-being are relational, that people draw strength from family, their neighbors, communities, and that success is shared rather than like this individual concept. So alongside Ubuntu, many clients bring adaptability, spiritual faith, rich cultural traditions. Storytelling is huge. And it's really central in Zimbabwean and broader Southern African communities. You know, lessons. I mean, the way even we teach children not to run into the street and things like that, it's all through storytelling. So being able to bring that and making it something that's meaningful in therapy spaces is huge for clients. So what does this mean for us as providers? So it means that we are going to work towards adopting a strengths-based view, right? You want to focus on existing skills, cultural assets, and not only the challenges that they may be facing. So we can ask clients, what coping strategies has worked for them before? How can we integrate them now in this new space that they're in? How can we also integrate spirituality or faith supports when appropriate? It's also about validating that sense of resilience, right? So recognizing and naming the ways that they have navigated hardship without minimizing the pain or the very real challenges they face. I know that that's something that comes up a lot in my community too. People are like always saying like, oh yeah, people say Zimbabweans are so resilient and all of this, but they feel like when people name that, they're acknowledging it, but they're also like just dismissing. They're like, oh yeah, you can go through, you've gone through a lot, you can endure a lot. But we don't want to endure that much, right? So you want to make sure that you're recognizing and validating that resilience, but not minimizing the pain that they faced. And focusing on strengths, that really helps you honor an individual's wisdom, their sense of agency, cultural resources, all of that. So this approach, it doesn't just improve outcomes for your clients, right? It really kind of aligns with that space of how are we maintaining our clients' dignity, how are we respecting them, and how are we just engaging in things that are culturally meaningful in their like healing space. So again, we're just wrapping up, and I want to make sure to highlight that there are very many ways that you can access a lot of resources that can help you with working with Southern African refugees. You can navigate to our website, which is rmtac.org, rmtac.org. If you click on the tabs that are kind of highlighted on this slide, you can access multiple resources that are available. So our service directory has over 17,000 agencies divided by state and territory. Our helpful resources tab lists a few online resources that can assist in navigating information related to newcomers. And we also have a resource library, which has some research updates, evidence-based articles, emerging practices, clinical guidelines, all of that can be helpful for you all. Check out our events page. You can see a little bit more about some of the upcoming events that we have as well, like this, as well as many more, learning communities, all of that we have coming up. And then also, I would like to highlight that if you all have enjoyed this webinar, this presentation, if you feel like you would like to receive this type of support for your team, we can offer consultation through like providing coaching sessions or like training sessions for you and your team on this topic or other similar topics. If you want to just reach out to us for any type of support in terms of consultation and technical assistance, it's very simple to do so. You just, again, go to our website. You'll see at the top, there's a blue button that says request consultation or technical assistance. It'll take you to a form. You complete that. One of us on our team will get back to you within 1 to 3 business days. Here are some of the references that I utilize with this presentation. We will make this presentation available to you all, so you are welcome to dive into some of those resources and references that are available. But on your screen now, you'll see a QR code for our survey. We would love to hear from you all what you thought of this webinar, this presentation. It also gives you an opportunity to share if there are any other topics you would like to hear us present on or speak on. We would appreciate your feedback. It helps us to make sure that we are providing information that's relevant to you all, and we can tailor our presentations to meet your needs. And also it helps us as part of our requirements as a SAMHSA funded project. But yes, I'm seeing some comments. Thank you all for being here, for engaging as much as you did with all the questions, dropping things in the chat. It was great. We're very thankful for your engagement. Thank you all for being here. Much appreciated.